Hello, I'm Sally Callow, Managing Director of Stripey Lightbulb CIC. I'm just popping in because I haven't done a YouTube live before for Stripey Lightbulb. Some of my followers of my advocacy platform, Emmy Foggy Dog, are used to seeing me on video, but not necessarily Stripey Lightbulb. Something's occurred to me. Over the past 3 years, I can't tell you how many people have contacted me and said, I'm desperately looking for information on long COVID. I keep seeing that C.F.S is strikingly similar. Will your training help me to help the member of staff that I'm currently dealing with, trying to encourage them back to work? Or will it help me with my patient who has got long COVID, but other than that, we don't know what's wrong with them? All sorts of things, all sorts of reasons for people getting in touch. And it's been really disheartening when they say, oh, actually, no, C.F.S isn't long COVID. Don't worry, I'll find something. I'll go and watch a webinar for half an hour. Because there's lots of long COVID webinars. And there are, I agree. But let me say this. For at least the past year, it's been widely acknowledged within the C.F.S patient community that at least half of long COVID cases meet the diagnostic criteria for C.F.S. And literally 2-3 weeks ago, the UK charities updated our prevalence estimate that was well over 15 years old. It said 250,000 for a really long time. And they've now updated it to 1.25 million in the UK. And that's CFS and post-COVID CFS. Now, the reason if they're calling it post-COVID CFS is it's, although these people meet our diagnostic criteria and they do have CFS, what we don't know is whether their recovery outcomes are as bad as CFS patients. We're all keeping everything crossed and are really hopeful that the people that have got CFS as a result of COVID-19 recover. But it is a fact that everybody that's got CFS as a result of any other trigger, only around 5% ever recover after that first 2 years post-infection. And it's far too soon to know the answer to that question, whether the recovery is the same for post-COVID CFS. And for research purposes, you have to kind of keep them in boxes at the moment. But I would personally say that we've now got 1.25 million CFS cases in the UK. Now, in our training, we include stats from all sorts of other continents, and we say this charity estimates that this many people have CFS on their continent or in their country. Unfortunately now, because it's long COVID isn't being counted as it should be, CFS has never been counted as it should be, we have to make really rough estimates. But what I would say, wherever you're watching this around the world, find out what your CFS estimate was before COVID, then find out what the long COVID estimate is for your country, halve the long COVID stats for 6 months post-infection, and add it to the pre-COVID estimate. That's how we have to do it at the moment, because governments simply are not acknowledging that COVID-19 is causing CFS. So if you have a member of staff or a student or a patient with long COVID and they have extreme exhaustion, and you see that they are deteriorating, as in all of their symptoms are flaring. I'm not talking about feeling tired after going for a walk. I'm talking about all of their symptoms flare, whether that's headache, nausea, vertigo, chest pain, joint pain, and they might explain it as I crash after I do too much. And it doesn't always have to be exercise or activity. It could be cognitive, mental energy, emotional energy. So if you have anyone under your duty of care that sounds like, and you want to learn more about the condition so that you can support them within their workplace, your workplace, whether that's learning or healthcare, please do our training, because at the very least, you will understand this kind of energy restricted illness. And you'll be able to support a lot more people who are under your duty of care, whether they've got CFS or not. But ME is an incredibly niche subject. I've been told that many times. However, 1.25 million means it's no longer niche. And before COVID hit, I was told, we all know what ME/CFS is. You don't have to keep going on about it. We know how to support these people. We're confident that we've got a disability policy. We've got no problem dealing with ME/CFS. If that's the case, why have I received hundreds of emails and phone calls asking, how on earth do I support this person who's got very little energy? They're a valued member of staff and I really don't want to lose them. If you knew what ME/CFS was, and if your disability policy was adequately supporting ME/CFS patients within your environment, you wouldn't have made that phone call because you would have known what you were dealing with. So yeah, please do sign up to our training. Now we have badges. So if you sign up and want a badge, please do put on the checkout, yes, I would like a badge, please. Because we want our learners to wear their badges so that patients will start to identify who knows about our disease and who doesn't. So yeah, sign up today. I've got ME/CFS myself. I do fit in Stripy Lightbulb's working hours around my own fluctuations and relapses. But it's an automated learning platform. So if you have insomnia one night and decide, I can't sleep, I'm going to learn about ME/CFS, you can sign up to our training 24 hours a day, 7 days a week, whether I'm in bed, unwell, or at my desk. So please do check out stripylightbulb.com and help us to improve the lives of patients by learning about the disease and adequately supporting them in working, learning, and healthcare environments. Thank you for listening.